everyone, welcome back to my channel. In this video we discuss respiratory system. ये लास्ट पार्ट है, इसमें हम सब डिस्कस कर लेंगे टॉपिक जो रेस्ट ऑफ आपके रह गए थे पहली वीडियो में। आपको पहले की वीडियो अगर इसमें कोई भी डाउट हो तो प्लीज़ कमेंट कर दीजिए, क्योंकि आपके रेस्पिरेटरी सिस्टम इम्पॉर्टेंट एक सिस्टम है जो कि यूनिवर्सिटी एग्जाम्स में क्वेश्चन आना है। आपको उसके एनाटॉमी फिजियोलॉजी दोनों अलग अलग आने चाहिए, क्योंकि कुछ भी क्वेश्चन पूछा जा सकता है। मेजॉरली आप इम्पॉर्टेंट क्वेश्चंस तो बाद में लर्न करेंगे, बट अभी टॉपिक वाइज और चैप्टर वाइज क्लियर करिए। इससे रिलेटेड कोई भी डाउट तो प्लीज़ कमेंटेड। इस वीडियो में आपका पूरा रेस्पिरेटरी सिस्टम कंप्लीट हो जाएगा। इससे रिलेटेड जो भी नोट्स होंगे, जो भी मेरे पास आशा लगता है कि बुक में पीडीएफ फॉर्म में इंपॉर्टेंट डायग्राम्स, इंपॉर्टेंट क्वेश्चंस और नोट्स होंगे, वो मैं टेलीग्राम चैनल पे प्रोवाइड कर दूँगी। अगर आपने टेलीग्राम चैनल को नहीं सब्सक्राइब करा है तो उसे सब्सक्राइब कर लीजिए, क्योंकि उस चैनल पे आपको इंपॉर्टेंट मिल जाएगा बीएससी नर्सिंग फर्स्ट सेमेस्टर से रिलेटेड। लास्ट तक वीडियो जरूर देखिएगा। इससे रिलेटेड कोई भी डाउट हो प्लीज कमेंट इट, लाइक द वीडियो, शेयर द वीडियो, सब्सक्राइब टू द चैनल। थैंक यू। Let's start with the topic breathing. Pulmonary ventilation. Movement of air into and out of lungs is known as breathing. Muscles of breathing. There are 11 intercostal muscles occupying space between 12 pair of ribs. During normal quiet breathing, external and intercostal muscles and diaphragm are used. Intercostal muscles. There are 11 intercostal muscles are arranged in two layers: external intercostal muscles and internal intercostal muscles. External intercostal muscles. These extended downward and forward from lower border of rib above to upper shoulder of rib. Internal intercostal muscles. These extend downward and backward from lower border of rib along to upper border of rib. Behave crossing the external intercostal muscle fiber at right angle. The internal intercostal are used when exhalation become active, as in exercise. Diaphragm. It is a dome-shaped muscular structure. It forms floor of thoracic cavity and roof abdominal cavity. These two cavities separated by diaphragm. When diaphragm relax, the control tendon is at a thoracic vertebrae. When it contracts, muscle fibers are contracted. Central tendon is pulled downward to level of 9 thoracic vertebrae. Accessory muscles of respiration. When extra efforts of respiration is required, additional muscles are used. Forced inspiration is assisted by sternocleidomastoid muscles and scalene muscle. Forced expiration is helpful by activity of internal intercostal muscles. Next we discuss cycle of breathing. Average respiration rate is 12 to 15 breaths per minute. Each breath consists of 3 phases: inspiration, expiration and pause. Breathing depends on change in pressure and volume in thoracic cavity. Air always flows from area of a high pressure to lower pressure. So, directly of pressure in lungs determine the direction of air flow. Next, we discuss lung volume and capacities. In hormonal quiet breathing, there are about incomplete respiratory cycle per minute. The lung and the air passage are nearly empty, and as the exchange of gases take place, only access the wall of the alveolar duct and alveoli. The remaining capacity of the respiratory passage is called anatomical dead space. Tidal volume. These are the capacities related to lung volumes. Tidal volume. This is the amount of air passing into and out of the lung during each cycle of breathing. You must learn the value, that is 500 ml at rest. Inspiratory reserve volume, that is IRV. This is the extra volume of air that can be inhaled into the lungs during maximal inspiration, that is over and above normal tidal volume. TV means tidal volume. Functional residual capacity, FRC. This is the amount of air remaining in the air passage and alveoli at the end of the quiet respiration. Tidal air mixes with this air because relative small changes in the composition of alveolar air. As blood flows continuously through the pulmonary capillaries, this means that exchange of gases is not interrupted between breaths, preventing movement to movement changes in the contract of blood gases. The functional residual volume also prevent collapse of the alveoli on expiration. Next we discuss ERV, that is expiratory reserve volume, which is defined as the largest volume of the air which can be expelled from the lungs during maximal expiration. Next we discuss VC, that means vital capacity. This is maximum volume of the air which can be moved into and out of the lungs. Vital capacity is equal to tidal volume plus IRV and ERV, inspiratory reserve volume plus expiratory reserve volume. Next we discuss total lung capacity, that is TLC. This is the maximum amount of air the lungs can hold. In an adult of average build, it is normally around 6 liters. Hopefully you clear all the topics related to respiratory system. Now your respiratory system chapter is completed. If you have any doubt, please comment it, like the video, share the video, subscribe to the channel. Thank you.